welcome. I'm again here for my next video. So today's main topic is psychoanalysis and psychological therapies. So first I'm gonna to explain psychoanalysis. What is psychoanalysis? Psychoanalysis is a set of theories and therapeutic techniques related to the study of the unconscious mind, which is together form of method of treatment for mental health. Psychoanalysis is a controversial discipline, and its validity as a science is constant. Non-athletes to its remain a strong influence within psychiatry. More so is some curators than others. Psychoanalysis concept is the widely used outside of the therapeutic arenas in areas such as psychoanalysis, literally criticism, as well as in the analysis of a film, fairy tales, and other cultural phenomena. So we go on to about this day on test or results about it. Psychoanalysis. The psychoanalysis use various techniques as encouragements for the client of developed insight into their behavior and the meaning of symptoms, including incubates, parameters, and association interpretations, like including dream analysis, resistance analysis, and transference analysis. The evidence that exists for the effectiveness of psychoanalysis as a treatment for psychological order in reviewed. The evidence base is significant of and growing, but less the might meet criteria for an amicable based therapy. So manifestation of this psychoanalysis controversies about the value of manifest dream in psychoanalysis are usually a matter of semantics, and the author included the two clinically meaningful questions about it: the mindset and dream. What we can do asked in the patient's report of a dreams, like useful in a fragmentation and interpret between the patient in so no formal association of the no dreams element are given is a much of as reports always include some kind of association to the dream elements. Reports always include some about the patients. The answer to yes question, this manifest dream contribute to our understanding of literature and clinical experience. One approach, the direct decoding to the manifest dream element, is discussed in some of memories of childhood traumatized experience in manifest dream are presented. Sigmund Frequent was the founder of psychoanalysis and the psychodynamic approach to psychology. So in these frequent theories of psychosexual states, the unconscious dream remain a popular topic among both psychiatric and lay persons, despite the fact and his skepticism my on many day. So medical treatments and nursing. Psychotherapy is form of depth talk therapy that aims to bring unconscious or deeply conscious so that represents experience of the emotions often surface. Therapist is the client look at how these repressed early thinking behavior relationships in adulthood. People with depression, emotional struggle, emotional trauma, neurotic behavior patterns, personal disorders, and personal disorganized relationship issues may benefit from psychoanalysis therapy. One small study found that 77% of patients reported significant improvement in symptoms. interpersonal problems quality of psychoanalytic therapy. Analytic therapy is the like problem quality in improving that therapy at a 1 year follow of 80% reportedly experienced improvements. Method of analyzing psychotic phenomena and treating emotional disorders that involves treatment sessions during which that patient is encouraged to talk freely about personal experience and peacefully, especially about early childhood and dreams. So psychoanalysis is the commonly used to treat depression and anxiety disorder. In psychoanalysis, Fred would have a patient lie on a couch to relax. He would sit behind them taking notes while they told him about their dreams and childhood memories. Psychoanalysis is a therapy of psychotherapology and treatment of mental disorder. Today's psychoanalysis has been marginalized and is struggling to survive in a hostile academic and clinical. And this is the last topic, our psychological therapies. So what is the psychological therapy? Psychological therapy, we call this one psychotherapy, yeah, talking therapy, it's all same. In is this use of psychological methods, particularly when based on regular personal interaction and adults, so help a person change behavior and overcome problems in desired ways. Psychotherapy aims to improve an individual well-being and mental health, to resolve or medical troublesome behaviors, beliefs, complications, thoughts, emotions, and improve to himself and social skills, relationships, all things. There is also a range of psychotherapies designs for children and adolescents, which typically involve play, such as a certain psychotherapies are considered evidence-based for treating some diagnosed mental disorders. Others has been criticized as pseudoscience. So there is only, I think, mostly four types of therapies there, like cognitive behavioral therapy, dialectical behavioral therapy, and number third is the interperson therapy, and number four is the family focused therapy. And there is a lot of, like, there are hundred of psychotherapies approach or school thoughts. By, I think, around by 1980 there were more than 250. So but by 1996, I think, the less than of the in this 21st century there were over 1,000 different named psychotherapies, some being minor varieties and major varieties, like some usual, unusual, like different of therapies. There are a lot of therapies, so we are just following. There is four mostly therapies, so some being major varieties while others, and very different conception of psychological ethics, or in practice therapy in often not of the one pure type but draw from a number of prescriptive and schools known as the integrative electric, the approach in the importance of the therapeutic relationship, also known as therapeutic alliance client client and therapist, is often regarded as curatorial psychotherapy. Common factors that therapy address disease and other cure aspect thought to be responsible for, like, effective psychotherapies. What we call them, I think it's around Sigmund found around 1856 to, I think, 1939 is lifetime. So he described about this one period, and a Venice neurologist who studied with Jean Martin and Carlos in 1885. So around that time they describe about this one, and other major element of his method is which changed thoughts the years included identifications of anxiety as a manifestation of finer confidence, diagnosis, and differentiation of parts and of the psychology county transference, like the patient's projections and therapies. We have to observe that his skills, what he's doing, what he's not doing, like around those things have to observe. So that one is we call counterference. So some of his concepts were too broad to embellish, to empirical testing and individuals. So and he was a critical for this way to Jasper's number. His patient name is the one. I think one patient name is the Jasper's number. Numerous major figures, abortage, refined fragrance therapies techniques, including Melin, Kellin, Donald. He's I think innovating in 1990s, 1960 I think around. So disorders has declined substantially. Different types of psychotherapy have been created along with the event of clinical trends of tests and them specifically these interrogant substitutive treatment and additionals, like what we call that one of the psychotherapies in youth issue and sclerosis and system of family treatment whole system, like a one system we can treat patients in with family also, like family focus with help with family members also they can make to. This is like those all are like therapies of piece of therapy may address specific forms of diagnosis mental illness or everyday problems in managing maintaining interpersonal relationships, meeting personal goals and course of therapy. After pharmacological psychotherapies are categorized several different ways. A distinction can be made between those based on a medical model, a humanistic model. Also in this medical model, the client is seen like unwell and the therapist employs their skills to help him to client back to health, like have to get better health back from like illness. And the existence use of the health DCM-4, the Diagnostic and Statistical Manual of Mental Disorder in United States. In United States, in an example, I think there is an example like what we call the conditions and therapists attempt a create residential environment for making better health. So he choose to a better like natural environment, what we call like natural, like open air, like in woods. He went in woods and he treat patients there. Like this all depend on his mind, like psychology. Another distinction is between individual one-to-one therapy sessions, like one-to-one therapy sessions, group psychotherapy, including couples therapy and family therapy. Therapies are something classified according to their duration, a small number of sessions, a few weeks or few months and year. It depends on patient or depends on therapist, all how he treating him or how he treat himself that patient. Like he treating like, oh, he want to be better or not, like he traumatized, like, oh, I can't be well more, I can't walk, I can't do, I can't. If in his dictionary like a can't word, so there is no effect of like these therapies. So guys, you okay, most forms of psychotherapy use spoke conversations. Some also use various other forms of communication such as we call that spoken conscience negative. From these non-verbal discussion, there are also different formats for delivery, some therapies as well as the you. So psychotherapy has the benefits of giving clients Of course, there is a lot of benefits of this psychotherapies, like what we call those medicine can't do. There's those things medicine can't do, like they can't make better, but psychotherapies can make better person. It all depends on situation or depend on patient. So what he want to take, like medicine or psychotherapy. If he able to, if there is no improvement of because of medicine or like anything else, so we can try this psychotherapy. It's, I think it's more benefits, like I think around 80% it's more this, so can create. So psychotherapy has the benefits of giving clients someone talk to it. It create a new way to looking at difficult problems and help people move toward a situation participants and can give a better understanding of themselves, their own goals and values, that can develop skills for improving relationships. Based on this, it's estimated of psychotherapy, it's effective for about 80% of people. Like meanwhile, between 5 to 10% of client may suffer adverse effect, I think. So psychotherapy or talk therapy is a way to help people. It's like it's all are same, like psychotherapy or talk therapy, it's same like way to help people. They can help like without anything. You can do follow is like psychotherapy, like you can follow at your homes of and you can improve your mental illness and emotional difficulties. Psychotherapies can help eliminate or control troubling symptoms, so a person can functioning better and can increase well-being and healing. So research generally slows that psychotherapy is more effective than medications, and the adding medications does not significantly improve outcomes from psychotherapies alone. People with several substance use problems may also benefit from the education of the certain medications that reduce craving and integration effective effects. So that's it, guys. If it's all up to depend on patient what he taking to treat. Like if he thinking, I mean, if his mindset is like he can't be improved, so he can't. It all depend on mindset also. My psychotherapy depend also on that. So like if you're thinking, oh, I'm going to improve, so it will be more benefits for you. It's now is 80%, so it's going to be 90. So that's is the psychotherapy is all I explained here. Thank you guys for watching this video, and I hope you like this one. Thank you everyone. Bye bye.